Health officials in West Texas urging the community to be vigilant after a child there died from complications with measles amid an outbreak there. According to the Texas Department of State Health Services, death was a school-aged child who was not vaccinated. CDC confirms it marks the first measles death in the U.S. since 2015. Hospital officials say more than 20 patients have been admitted for measles and several have required intensive care. They note that most of the cases reported in the outbreak are in people who are unvaccinated or whose vaccination status is unknown. So how worried should we be about the measles here in southern Nevada, and what's the best way to prevent it? Joining us now to give us some answers, Dr. Kahn from the UNLV School of Medicine. Dr. Kahn, we appreciate your time on this very important topic. I thought 25 years ago, I think it was the CDC, announced that measles have been eradicated in the United States of America. But here we go again. What happened?
Yeah, so in 2000 or thereabouts, measles was effectively eliminated from the United States population. The problem is people can come in from other countries and bring measles in. So there have been sporadic small outbreaks of measles. What we're seeing now in Texas is a large population of unvaccinated people who are able to get infected and actually transmit the virus.
And you told me it's highly communicable, in fact, far more communicable than COVID or the flu. So this thing spreads rapidly and quite easily.
It's one of the most communicable viral infections that we have. It can linger on surfaces. It can be aerosolized in the air. It's so communicable that if you were born prior to 1957, there's an assumption that you've already been exposed and already have immunity because prior to vaccination in 1963, it was one of the most communicable diseases that we knew.
Okay, so when I was a kid, I got the measles vaccine. Should I get a booster shot?
So right now, we don't think people need booster vaccines. If you received both measles vaccines, and right now the first dose is indicated around a year of age. The second vaccine is before you start school. It's given as an initial vaccine and then a booster. We suspect and believe that immunity is lifelong.
Okay, so if you had those two shots, the initial and the booster, are you protected from measles? In other words, if we had a measles outbreak in Nevada, which we have not yet had, I want to make that very clear to everybody, but if we had a measles outbreak, would the vaccine protect you? In other words, would you not get sick with the measles if you've been vaccinated?
That's correct. If you've had both vaccines, you're expected to be immune. Absolutely.
Okay, and we've heard a lot of vaccine skepticism of late in recent years, ever since COVID. And not all vaccines are created equal. In fact, not all vaccines are created in the same way. But is the measles vaccine safe for people to take?
The answer is yes. We've had decades and decades of experience. Not only is it safe, but it's one of the most effective vaccines that we have. So after the initial vaccination, you have about 93% immunity, and that goes above 97% with the vaccine booster. So the measles vaccine is not only effective, but decades of experience have taught us that it's a very safe vaccine. It is a live attenuated virus. That means it's a milder virus that can cause measles. Some people get a rash and kids get a slight fever from it, but otherwise it's very safe. Okay. Because it's a live vaccine, it is contraindicated in people with significant immunodeficiency or pregnant women. But otherwise, safe and effective vaccine.
Okay, look, we got 5 seconds left, so this needs to be a quick answer, but do we need to be worried about the spread of this highly communicable disease called measles around the country like we were concerned with COVID 5 years ago?
I think we have a significant amount of immunity in our population, so it's not going to be another pandemic. But for people who aren't vaccinated, measles is a potentially life-threatening illness, and you ought to get vaccinated.
Okay, you heard the message there, everybody, from Dr. Kahn from the UNLV School of Medicine. Get vaccinated. Dr. Kahn, thank you. We appreciate it. And we're asking everybody out there today, are you concerned about the measles outbreak? Let us know what you think by scanning the QR code or head to news3lv.com.